I'm Dr. Katie, the Senior Centered Physical Therapist, and welcome back to my channel. On today's video, we are going to be working on knee instability. So I'll be showing you exercises that will really help decrease your knee instability and hopefully decrease your pain as well. If you want more information about knee instability, please check out my site, theseniorcenteredpt.com. Also, in this workout, I'm going to be showing you how to do the exercises, and I recommend you do about 3 sets of 8 to 10, depending on what your body can do of each exercise. Today, I'm just going through the basics, and we'll do about 1 set of each, but make sure you either rewatch this video or you pause it and do your 3 sets in order to really gain strength. For this exercise video, I recommend having a physio ball if you have one. You can also have ankle weights, as well as hand weights or a kettlebell if you have them. And then make sure you have a mat or a mat table or a surface that's easy for you to get down to and up from, that's nice and stable to do some lying down on your back and lying down on your side work. We are going to start with making sure we know all the muscles we're working in this exercise video. But before we do, make sure you click that subscribe bell as well as the thumbs up button, as this really helps people to find my channel and to share this information. If you're ready, let's get started.
For our squats, we're going to be working our quadriceps muscles. So the muscles in the front of the leg here, as well as working some muscles in the back. So working our gluteus muscles and our hamstring. So 3 muscles in the back of the leg here that make up the hamstrings. Then when we're doing that side lying hip abduction, we're working our gluteus medius. So a little bit more internal to gluteus maximus as well as gluteus minimus right there. And then our tensor fasciae lata, this muscle running down the side of the leg. For the hamstring curls, of course, we're working our hamstrings, but we're also going to be working our rectus abdominis. And then we're going to be working our glutes as well in that one, in addition to the hamstrings. For deadlifts, we're working glute max again, our hamstrings, as well as erector spinae muscles here, and our lats, as well as our traps. And then moving down into the leg, we're going to be working our adductor magnus, as well as our soleus, so the deep muscle of the calf, and the gastroc, the more superficial muscle of the calf. Then for our lunges, we're going to be working our hamstrings again, those muscles back here, as well as our glutes. And then we're going to be working those quadricep muscles again with lunges as well. So lots of muscles we're working in this workout. Let's get started. This anatomy model was brought to us by anatomylearning.com.
For our squats, I am going to use a physio ball or an exercise ball, whatever you would like to call this thing, and I'm going to place it against a wall. If you don't have a physio ball, you can do squats without the ball, and that's completely fine. I just think the physio ball provides nice feedback. So I'm going to take my ball and I'm going to put it against the wall, and then I'm going to lean against my ball. So the ball is here. I'm going to lean against my ball, and my feet have to be walked out a little in front of me. That way I'm not too close to the wall. And I'm going to imagine I'm wrapping my back around the ball as I sit. So I wrap my back and I sit. Wrap, sit, and I could hold this position right here. And what I'm doing here is I'm getting a little bit of that back extension, as well as the glute work, as well as the quad work. And then I stand back up, getting back of the leg. So I wrap, sit, and then I stand. Good. Let's do 7 more of these. Inhale down, exhale up. Making sure my weight is evenly through my feet. Let's go for 3, stand, 2, stand, last 1, stand it up, hold on to that ball. Make sure you've pushed away from the wall to grab it. So if you're doing this without the ball, you can set the ball to the side, and you can put your hand on the wall, or you can put your hand on a chair, and you just want to make sure your feet are outside of your hips, so shoulder width or even a little bit wider, and you're thinking about that same wrap the back motion. Or imagine you're sitting in a chair. We sit and we stand. Sit and stand. Sit and stand. What we don't want to do is clench the booty. Our booty is working already. We don't need to tighten it at the top. We just need to sit and stand. Sit and stand. Making sure we're not rounding. Notice that nice upright posture. I'm keeping my chest lifted. Let's go for 3 and 2. Last one. And stand it all the way up. Next, we're going to be doing our side lying hip abduction. So grab your mat or your mat table in order to lay down on. Okay, to do our side lying hip abduction, we're going to lay down on our side. If you would like to use a physio ball for this next exercise following our side lying hip abduction, then I recommend having it nice and close. That way you can just grab it from this position and don't let your ball roll away. So we're putting it down there. I'm gonna lay down to my side. Notice how I do this, swinging the legs up and then making sure I have enough room in front of me and behind me if you're on a table or surface that's off the ground. And then I'm just gonna lay my head down on my elbow. My bottom leg's gonna stay bent kind of as a kickstand as my top leg straightens out. And I'm gonna lift and lower. Notice how small of a movement this is. It's coming from the glute, right here. If you go too high, you're coming from the waist. We don't want that. We want glute. We wanna help strengthen those hips to help align the knee and help keep it nice and stable. So let's go for 5, 4, 3, 2, 1, and bring it back down. From here, we're just gonna roll to the other side. So I'm gonna sit all the way up, swing my legs down, and then switch sides. So taking my time laying all the way down, keeping my bottom leg bent, straightening that top leg, and then I lift and lower from the glute. So a big mistake people make is they roll back and then we're working our hip flexors. We don't want that. We want to make sure we're keeping in that booty. This is what helps really strengthen the hips, which really helps keep the knee in alignment. So we're gonna lift and lower from the booty, that nice little movement. Let's go for 5, 6, 7, 8, 9, 10, and bring it in. The next exercise we're gonna do is our hamstring curls with our physio ball. So go ahead and grab that if you have one. We're gonna take this ball and we're gonna roll down to our side. So pop those legs up and then move on to the back. And then I'm gonna take this ball and put it underneath my feet here. And I'm gonna straighten the legs out all the way. So make sure you have plenty of room, your head is supported. And this you can do on the floor, probably much more easily than you can do on the bed. So if you can get down to the floor, do that. If you can't, I will show you an alternative hamstring curl here in just a moment. So what you're gonna do is you're gonna lift those hips up off of the floor, and then you're gonna curl in. And then you're gonna straighten back out. And you're gonna exhale as you bring the ball in towards the booty, and inhale back out. Exhale. Inhale back out. Let's go for 3 more. Feeling those hamstrings working. Shaking. Last one. Ball goes out, and then we lower back down. From here, I'm just gonna move that ball out from underneath me, so I'm just gonna drop mine off the table, and then take my time to sit up all the way. Take a moment, make sure you're balanced before you stand up. Now I'm gonna show you the alternative that you can do for hamstring curls if you don't have a physio ball or have a hard time getting down to the floor. So grab a chair for this one, and if you have ankle weights, you can use that as well. For standing hamstring curls, if you have an ankle weight, you're just gonna wrap it right around your ankle. Then you're gonna stand with your feet about hip distance apart, and you're just going to lift and lower the foot. So notice I don't let the knee go way far back. I'm trying to keep my knees parallel as I lift up and back down. Lift up and back down. Lift up and back down. A big mistake people make is they allow themselves to lean forward as well. So that would look like this. And we really don't want to do that. We want to stand up nice and tall. We want to find stability in our standing leg. And then we lift, thinking about finding length in the front of the leg and then that curl in the back of the leg. So lengthen the front, curl the back. Let's go for 3 and 2 and 1. Back down, and then you would just switch sides. If you only have one ankle weight, make sure you put the weight on the other side as well to even it out. For the deadlift, I am going to use a kettlebell. You do not have to use any weight at all, but if you're using that kettlebell or any weight, you can also use a hand weight. I want you to very carefully place it down right between your feet. So there's a couple ways we can start a deadlift. So the first thing I'm gonna do is just show us how we can do it from seated to standing. So I'm gonna take a seat. And the deadlift motion is very similar to that of standing up. So if my hands are down by my side, I'm gonna lift and lower. I'm gonna lift and lower. Notice I'm keeping my back flat and lower, and I'm just hinging at the hips. So what I mean is I'm not lifting like this. I'm keeping a nice upright posture as I lift and I lower. I lift and I lower. So that's how you can do it from a seated position if you're not ready to add weight or if you're not ready to start from standing. If you're ready to start from standing, we're gonna stand up and it'll look like this. So I'm gonna tip and then stand. I tip and I stand. So I've got a slight bend in my knee and I hinge at the hip. I tip and I stand. And I tell my patients all the time, think of it like a bowing motion. We bow and come up. We bow and come up. Now let's add the weight. So I would bow, grab my weight, and not allowing my back to round, I stand back up. And I bow and I stand. And I bow and I stand. And I bow and I stand. So your eyes should look about 6 feet in front of you on the floor as you bow. And stand, 2 more. And stand, last one. Good. Now gently bring that weight back down. And stand it all the way up. Now we're gonna move on to our lunges. For our lunges, we're gonna have our stable surface in front of us, or we can have the stable surface to the side of us, but we just wanna make sure we have enough room to step back. So I'm gonna have my stable surface out in front here, and I'm gonna take a big step back with my left leg. So I take that step back. Notice here that I don't step directly behind myself because then I'm a little bit more off balance. So I'm gonna take a step back and it's gonna be out to the side. Now from here, you can either hold on if you need support, which is nice to have that countertop or chair by your side rather than in front of you, or you can just place your hands on your hips if you don't need the balance support. And watch what I do here. I'm going straight down. And then I'm actually placing my weight in my back leg here as I push straight back up. What tends to happen is people tend to lunge forward. And what that causes is an excess stress on the knee, which actually causes knee pain, so people avoid lunges. So instead, I want that weight evenly between my front and back leg, and then I go straight down and straight back up. Straight down and straight back up. Straight down, straight back up. Let's do 7 more. Here's 6 and 5. So it's really like a single leg squat instead of a lunge. And 3 and 2 and 1. And I'm gonna stand all the way up, take a step in, and then I can switch legs. So I'm gonna turn so you can see me. But I'm gonna take now my right leg back, making sure I've given myself enough space out to the side there. And then I'm gonna put my hands on my hip as I lower straight down and push straight back up. Straight down, push straight back up. Really feeling the weight on the back leg. Not neglecting to shift that weight to center. Remember, if we're too far forward, that can cause pain. So straight down, straight back up. Let's go for 5 more. 3, 2, and last one. And stand it all the way in. Excellent job. Now we're going to move on to our last exercise, which is our heel raise. I'm gonna start with my feet about hip width apart. So that's right underneath my hip bones, not wider. I'm gonna lift my heels and bring them close together. If you can get them to touch, great. If you can't, that's okay too. What you can do is put a pillow or a yoga block in between your heels and you can squeeze that instead of your heels. But my heels are together, my toes are turned outward, and what I'm gonna do is I'm gonna squeeze those heels together to get glute activation, and then I'm gonna lift the heels up and lower down. Lift and lower. So you can either have your chair on your side or your chair or your countertop right in front of you, but you're lifting straight up and lowering straight down. Lift and lower, lift and lower. Let's do 5 and 4, 3, squeeze those heels, 2, last one, and lower down. What you should notice is that your glutes are actually on fire. So a lot of times we think of heel raises as just a calf workout, and actually we're really working more of that glute if we utilize our heel squeeze in that. Thank you so much for watching this video. I hope you enjoyed this workout and will continue to use it to help decrease your knee instability. Please remember to hit the subscribe button and that bell. Also, give this video a thumbs up and share it with your friends and family. Please check out my blog, theseniorcenteredpt.com, for any information you need on a variety of topics. As always, I'm Dr. Katie, the senior-centered physical therapist, and have the strength to live life to the fullest. Bye-bye.